Hepatitis B? I'm as healthy as a horse, okay? Do I look sick to you?
Nope, it's not true. Hepatitis B can infect anyone. It mainly transmitted from mothers and when early childhood, either blood transfusion, using infected needles, and direct contact with an open wound. And hepatitis B can live alive in human body fluids for 7 days outside the human body. So you never know where you can get exposed. It can be anywhere. So yes, you can get infected even though you feel well.
Hey, what's up, man?
Hey, what's up? I'm not touching you.
Why not?
Which hepatitis you got? A, B, or C? Doesn't matter. You got it. I'm not touching you.
It's not an STD.
No, not really. No. Okay, hepatitis B is not transmitted airborne. You sit next to each other. No, you don't get infected like that. You get infected if you share your toothbrush, your shaver, or if he gets hurt, have an open wound, and you go touch his or her open wound, have his blood splash on you or something. Yes, that is considered an exposure, and we need to screen you for possible infection.
What are you reading, man?
No, I'm just reading about this hepatitis B.
Oh. Have you gotten your shot?
Yeah, of course lah. I took the shot when I was a baby. So I think I'm immune for life. Good.
No.
Why?
Most people get immune after get vaccination with hepatitis B during their childhood. But some people loses this immunity as they grow older. If you have a high risk of getting infected, I would suggest that you get screened and you check the level of your antibodies inside your body, so you know whether you have enough antibodies to protect you from getting infected with hepatitis B. When we say high-risk people to get hepatitis B, either your parents, especially your mother, have hepatitis B itself because it's transmitted at birth, or your siblings, when you grow up next to each other in childhood, maybe you like fight each other, bite each other. Yeah, you can get exposed, infected like that. If you are a healthcare worker, either a doctor or a nurse, you can get hepatitis B through needle prick injury. Patients who receive regular blood transfusion, like dialysis patients and patients with cancer, patients with blood clotting problem, thalassemia, who requires a lot of blood transfusion, well, they have higher risk of contracting hepatitis B through the blood transfusion itself.
Am I gonna die? Am I gonna die? Am I?
Once you get it, there's not much symptoms. During the acute infection itself, you can feel a short period of unwellness, but it can lead to a life-threatening complication called liver failure. The earlier that you get infected, if you get infected during childhood, the higher risk of you getting liver failure later in life. And when you get liver failure, right, it can cause you a lot of complications that can lead to death.
What? Hepatitis B? So what happened to my baby? Can I still breastfeed my baby?
Mothers with hepatitis B actually can breastfeed their children, babies, provided that the babies have been vaccinated and develop enough immunity. They should get treatment early and preferably in a hospital with a specialist.